Hi, my name's Katie, and the only thing you really need to know about me right now is that I have PCOS. I was diagnosed when I was 19 or 20, and even prior to being diagnosed, I knew that I had it, and I was researching and trying to do all the things, and now I feel like I'm sort of a walking Wikipedia page on the condition. And so today, what I wanted to do was talk about some myths that you hear with PCOS, some bullshit, if you will, and get into like where those myths come from and like what the truth is of PCOS. So the other thing that you could know about me, I guess, is that I've lost 70 pounds at this point. In 1 year, I've lost 70 pounds. 71 if we're being particular, but like who cares, right? And so I do still, have a little bit more to lose, but I feel like my PCOS right now is managed, or at least as managed as it can be. And I want to share my story and my experience and maybe help other people who are going through a diagnosis right now or think that they might have it or just aren't, they know they have it, maybe they're not super educated on it. Maybe you learn better from listening to people talk about it. So that is my goal, is to just help people. If I help even one person, then that, mission accomplished. So let's get into some myths and lies that you might hear about PCOS. And I'm going to include like some personal stories in this because I was told one of these lies by a medical professional, and we'll get there when we get there. So number one, I have notes too. I did write some things down so that I wouldn't forget, because I do tend to like start here and end over here, and we're not doing that today. So number one, you must have cysts on your ovaries to have PCOS. So the name is polycystic ovary syndrome. That's actually kind of misleading. You don't need cysts on your ovaries to get a diagnosis. If you're having other symptoms, you can still get a diagnosis. I actually just had a conversation with somebody yesterday who has no cysts on her ovaries, but she wasn't ovulating normally, and she got diagnosed with PCOS even though she doesn't have cysts. So how do they diagnose you? I forget the name for this criteria. I know there's a name for it. It's the something criteria. And basically how they diagnose you is you have to have two of these three things. So number one is irregular or absent periods. Number two is signs of elevated androgens, which are like male hormones. So that would be acne, hair growth on the face, hair loss on the head. And they can test your blood for that too. And then polycystic ovaries visible on ultrasound. So you only need two of the three to be diagnosed. So cysts may not even be present. For me, I did have all three. Number two, PCOS only affects overweight and obese women. Now, when I was diagnosed, I was overweight, but prior to that, I knew I had PCOS and I was not overweight yet. I don't know at what point my insulin decided to just go like completely off the charts, but I did end up gaining 80 pounds in a year. And I'm 70 pounds down now, which is crazy. And the woman that I talked to yesterday, actually, the one that I said didn't have cysts, she's also like, you could push her down, she would fly away in the wind. She's not overweight whatsoever. She has PCOS, and you don't have to be. I've heard people call it lean PCOS. I don't know if that's like a scientific term or not, but I have heard the term lean PCOS before. So even if you're thin or lean, you can still have a hormonal imbalance. Unfortunately, PCOS does not discriminate. Insulin resistance and weight gain are common symptoms, but they're not causes. So genetics and hormonal factors and things like that will play a pretty big role. Myth number three is that PCOS is just a reproductive disorder. So if I'm not trying to get pregnant, why should I care that I have it, right? PCOS affects much more than fertility, unfortunately. It is complex, it's hormonal and metabolic, and it can impact your entire body. People with PCOS have an increased risk for type 2 diabetes, which I was, heading down that road before I lost weight. Now my insulin is normal, at least at our last checkup. You're at higher risk for high cholesterol, high blood pressure, heart disease, and endometrial cancer, as well as just anxiety and depression. So even if you're not thinking about kids ever, managing PCOS is crucial for long-term health. For me, I get the anxiety and depression, which right now, like knock on wood, is treated. It's good. I'm okay right now. I don't want to go back to any sort of like intense depression or anything. I do get anxiety, but it's not like disrupting daily living at this point. So I don't think I think it's just a normal amount of anxiety. But for me, like, I get the fatigue so bad. My periods are affected so terrible. Like, it's awful. So I think even if I never wanted kids, I would have still gone down the route of like getting diagnosed and getting treated just because I felt like shit. Plus the weight gain that I had, 80 pounds in a year is a lot. And I just, the self-hatred and the self-loathing and the what am I doing wrong and all of that, I would have still sought out treatment just because of like poor body image. Myth number 4, you can't get pregnant if you have PCOS. So this is the one that a medical professional told me. She was the one who diagnosed me, and for that I'm forever grateful, but you can still get pregnant. What she said to me was that when I want to start trying to have a baby, I would probably immediately just get put on some sort of medication that helps with ovulation. She didn't say, like, you're never getting pregnant, but she did say that I would need help to get pregnant. And it was for that reason that I got off of birth control, because I didn't see the point in it anymore, and then got pregnant a couple of months later. So I know that so many people with PCOS struggle and struggle and struggle and struggle. And like, I'm not trying to say like, you can get pregnant still. It's still super easy to get pregnant. It's just still possible. There's a difference between infertility and being sterile. And my 19-year-old self took you're infertile or you're going to struggle with fertility as you're sterile and you don't need to worry about this anymore. So I did end up getting pregnant when I was like 20, maybe 21. Yes, it may be more difficult to conceive because you are not ovulating as a normal functional body would be ovulating, but many people do get pregnant naturally or with medical support. There's medications, there's lifestyle changes, there's fertility treatments, and they have helped, tons of people. So it's number 5 is birth control pills cure PCOS. So kind of going into like getting off of birth control, my reasoning for it. It's prescribed to manage symptoms like mostly irregular periods. It's not a cure. It regulates your hormones, but it does it in an artificial way. So it creates like predictable cycles. When you stop the pill, your original symptoms will probably return. It is a tool for symptom management, but not a permanent fix. So I was off of it for like 5 years. I just only got back on it because I am on Wegovy, and you are not supposed to get pregnant on Wegovy, and I didn't want to take the chance. So I did get back on birth control, and I did have to go through, I think, 2 different kinds before I got to one that I feel like not crazy on. That's a whole other story, and I don't need to get into that because we'll be here forever. But my symptoms were pretty much managed before I got back on birth control. And then when I got back on it, I had a lot of bleeding and a lot of like irregularities happening. And now I feel like it's leveled out again to the point where it's like, okay. But it's not a permanent fix. A lot of women really hate it. You get mood swings, you get irritability, whatever else. Every birth control has like different things that happen to your body. Some people love it and some people, really like swear by it. Personally, I wouldn't be on it right now if I wasn't on Wegovy, but I mean, it's fine. So it's not a cure, but a lot of doctors will do that as the first form of treatment. Number 6 is if your periods are regular, you don't have PCOS. So some people with PCOS do get regular periods, but they have other signs like high testosterone, excess facial and body hair, polycystic ovaries, hair loss, whatever. Regular cycles don't rule out PCOS, and that's why like blood tests and ultrasounds are like important for a diagnosis. My periods were not regular, so I don't have experience with that, but I do know that some people have regular periods and can still have PCOS. So if you're sitting there like, oh, I have all of the symptoms, but my periods are regular, you could still have it. Number 7, PCOS is caused by a poor diet or lack of exercise. Now this puts like unfair blame on people with PCOS. The reality is that it's likely genetic and hormonal. It's not caused by lifestyle choices. I was going through a Reddit thread one day that was asking basically like, how did you grow up? If you have PCOS, how did you grow up? were you raised with like processed foods and chemicals and all of these things? And there were several comments saying like, and I know this is anecdotal, but there were several comments saying, I grew up with like a, granola mom who wouldn't let us have sugar, wouldn't let us have food dyes, wouldn't let us have anything processed. And I'm sitting here today with PCOS. So I don't think like your diet choices or lack of exercise has anything to do with PCOS. When I was diagnosed, I had been already working really hard on my diet and lifestyle, and I still, gained those 80 pounds and, struggled for years to lose them. Diet and exercise can certainly help manage your symptoms. Like, that's really important, especially if you have insulin resistance. But it can't reverse the condition, and it didn't cause the condition either. Myth number 8, which I've kind of talked about a little bit, is that all people with PCOS have the same symptoms. So PCOS varies greatly from person to person. It's a syndrome, which is a collection of symptoms, not a one-size-fits-all disease. So common symptoms are irregular or missed periods, acne, oily skin, weight gain or difficulty losing weight, excess facial or body hair, thinning hair or hair loss, and fertility struggles. You could only have a few of these symptoms. You could have every single one, and that's why personalized treatment is so important. And I think I read something somewhere that that's why the studies for PCOS are so weird, is because like it's so different for everyone that if they get a group of people with PCOS together in a room and they don't all have the same symptoms, then like the medication or whatever they're doing the study on is different for everyone because symptoms are different. Number 9 is that PCOS will go away after menopause. And I've also seen people say that like it'll go away if you get a hysterectomy. Periods may stop after menopause, but PCOS does not. And I've even heard that after going through menopause, some people end up with more symptoms than they had prior to menopause. Some risks increase, like insulin resistance, high cholesterol, cardiovascular problems, still need monitoring after menopause. PCOS is a lifelong condition and requires lifelong attention. Number 10 is that losing weight will cure PCOS. So losing even 5% of your body weight can improve symptoms like ovulation and insulin sensitivity, but it won't cure PCOS. Many people still struggle with symptoms despite weight loss. I have lost 70 pounds at this point, and I can tell you that yes, it's a lot better, but I do still struggle some months, especially on my period. Like, I am on birth control right now, for example. This is just, again, anecdotal. I should not be ovulating. But according to my period app, like if I wasn't on birth control, I would be ovulating yesterday. So I went ahead and took an ovulation test because I had one, and I thought it'd be funny to, see. And it was positive, and I shouldn't be ovulating because I'm on a brand of birth control pill that specifies that you're not supposed to be ovulating on it. And I guess PCOS can trigger false positives for ovulation tests, which I didn't know. So I'm still definitely like something is haywire in there. I'm just able to lose weight now, and I'm not struggling so hard with like the insulin sensitivity. But like there are other things that I'm still struggling with, even though I've lost 70 pounds at this point. The next myth that I have is that natural remedies or diets can cure PCOS, and I'm sure that this one is like probably going to be the most controversial, which is why she's been saved for last. I have tried every diet, I have tried every vitamin, and I know it works for some people. I am aware that like some people do, the Mediterranean diet or like a low inflammation diet or the diabetic diet, and those things do help and like cure them, like you are able to lose weight at that point. No, it didn't work for me. It's, not always. Sometimes things just need to be treated with medication, and it took me a really long time to accept that because I had fought so hard on all of these diets and all of these supplements and all of these exercise routines and, and it didn't work for me, and that's okay. It's okay to go on medicine if you need to. There are some studies about inositol and PCOS and like that actually being something that works about the same as metformin, which is great. Omega-3s, vitamin D, those can help support hormone regulation, but there's no known cure for PCOS. And if there is an influencer out there saying that there's a cure for it, then they are just trying to get your money. Diets like low GI, anti-inflammatory, or Mediterranean can be helpful, but like results are going to vary for every person. If you're watching this, I really hope that you find the right combination of like medical support, lifestyle changes, education, friends, other people with PCOS that you can talk to. I am not sitting here trying to sell you anything. At this point in recording, I have 5 subscribers. No one would sponsor someone with five subscribers. So I will tell you straight up, some diets can be helpful, some things can be helpful, but it's not going to cure you. That's all I have for today, some myths about PCOS. I was thinking about my next video being myths about Wegovy. People like to talk a lot of shit on GLP-1s, and it is offensive. I mean, I do get a little heated about it. In the description of this video, there will be sources to what I said today, links to studies and articles and things like that. All science-based, all backed up by professionals, since I am not a professional. Sorry if this was completely all over the place. I don't know what's going on with my brain lately, but I feel like I've been kind of like on a high, and I'm sure like it's not gonna last long, so I'm gonna go clean my house. Okay, bye.